fish. Let's start studying. Don't worry about anything. Okay. Not now, shall we study for 1 to 2 hours and then I'll ask, okay? I'm studying micro for now. Good evening, guys. Please study for some time without distractions, okay? Oh, I'm so sorry. Okay. Mini, I was talking about Entamoeba coli yesterday. Uh, you jumbled it actually. We are talking about cystic forms in Entamoeba histolytica and Entamoeba coli, wherein Entamoeba coli has 8 nuclei. Histolytica has only 4, as we know tetranucleates exist, right? So 4 only. And also, I have given the mock. First, you guys tell me how was your INI mock of prep ladder, if you have given it, because that is what I have given in the morning session today, because it will end tomorrow, right? So let me know how you guys did it. I felt it as moderate. So many of matchings, match the following, so many statement questions. So I don't know whether my score is good score or bad score. I don't know. I have to improve a lot, but I'm waiting for the result tomorrow. How many questions you got correct? Let me know. And if you want questions to be asked, just let me know. Then maybe we'll discuss some questions and then I'll just close the live, because this is very difficult for me to sit in front of this without a proper chair maybe, and proper setting of everything in the life, and I feel I'm more productive without life. I don't know, I have to see. Let me know. I will ask questions if you want it now, and also let me know how was your INI mock of prep ladder. Okay. You want it at the starting part of stream, Krish, because um I mean it will deviate people, I don't know, but let me know whether these sessions are actually useful or not the question part but the live session part, because it is just stressful to me. If it is useful, then I'll do. I sometimes feel like I don't want to do anything in social media. No replies. I'm studying microbiology part right now, because I'm very weak at it and it's been a long time I have touched with the microbiology, so I just want to go through it. So shall I ask some questions and for maybe 15 minutes and then we'll close the session? What else? Still be active, guys. And also, how did you feel the prep ladder mock? Please let me know. I don't know, people are listening to it or not, or maybe people are studying seriously. Yeah, I have given the marrow mock already. Worst INA mock. I didn't write it well. In fact, the GT10 is far more better than the INA mock, is what I felt in marrow. Yeah, I'm studying it. Like, I'm just incorporating the stuff from the LRR into BTR, which was not there in BTR. Because I may not go through the LRR PDF again and again. The marrow one, yeah, I felt both of them difficult only. Marrow was difficult But Prepladder was slightly on easier side in one-liners, and it is difficult in statement type of questions, and the matchings are little bit tougher for me. I don't know how it is for other people. Yeah, but I scored better than Marrow mark in Prepladder mark, but not good score. It's okay. Okay, then shall I ask some questions and then shall I stop, or let me know what to do? Because I don't know, people have asked and then they vanish. Okay, then I'll ask some questions. People would join in between. People are joining, leaving. Okay. Okay. Carom coin colonies are seen in which organism? Because I've been doing micro, I will ask that. Carom coin colonies are seen in. Be quick. Carom coin colonies are seen in stormy clot appearance in that in test tube in culture. Stormy clot, where do you see it? Yeah, Kisugi, you are right. It is Streptococcus pneumonia. We see carom coin colonies. And what about stormy clot appearance? Yeah, Clostridium, yes, tetany. And where else we see terminal spores in Clostridium family? Terminal spores are seen in tetany, and another one I guess terminal spores are seen in tetany. You are right, Chikale. It's right. And can you tell me what is the characteristic appearance in Babesia, and what is the vector for Babesia? Yes, Himanshu, need PG preparation. Not bifermentins. Bifermentins is for central. Ma'am said it na. If it is in center, it will divide it into two parts. So central spore is bifermentins. So welcome, Himanshu. You can answer some questions if you want actively. Okay. Can you tell me okay then. Can you guys tell me, as I have asked now, Babesia, what is the vector for Babesia and the characteristic appearance in microscopy? Okay, the vector for Babesia, anyone can answer, you can answer. It is exodistic. It is stick, that lover. Yeah, it is exodistic, and it has multi-scross appearance because it is so easy to forget. Okay, what is the treatment of choice for Chagas disease. Treatment of choice for Chagas disease. No, it is not cotinol. No, guys. No. Chagas, what is the causative organism first of all? No, it is not doxy. Think, guys, what is the organism for Chagas disease? Yeah, Mini, you're right. Cruzy. So, what is the treatment for it? Yeah, you're right, Manogna. Yeah, Cruzy, you're right, Dekisugi. What? No. For Cruzy, what is the drug of choice, guys? Because it is cruise, you know, some vehicle will be there. Cruise is ship, na. So benzonidazole. Benz is a vehicle like car, na. So this is how you can remember. Cruzy Chagas disease is benzonidazole. Yeah, you're right, Chikale. It is right, benzonidazole. And what is the drug of choice for leishmaniasis? Yeah, amphotericin B, liposomal amphotericin B, not topical. It is severe. Leishmaniasis is severe. Dekusugi. We have to give liposomal. I don't think amphotericin B has topical formulation. I don't know, but it is liposomal. Yeah. Okay. Then shall I ask only micro or shall I jump to another subject? I'll ask the questions which I don't know the answer for because I haven't revised surgery some topics. So my Maynard's hernia is for which one? What is it? And Pantaloon's hernia. Can you tell me what is it? Can you revise it for me? Pantaloon's hernia, Maynard's hernia. It's okay, Dekisugi. Thank you so much. All the best to you too. Study from now. Okay. Okay, bye. I don't know, you have to tell me. As I said, this is the only question for you, not answer. Please check and tell me, or wait, I'll just check it out because I don't remember it. The hernia's part. It is not Maynard's but ambient hernia is for appendix. And pantaloon, yeah, you are right, it is direct plus indirect hernia. Pantaloons. I asked pantaloons hernia, Mini. Okay. I'll just go through the LRR. So floppy baby syndrome is caused by which organism? Floppy baby syndrome is caused by which organism? Yeah, you're right, Chikale. Yeah, botulinum. Can you tell me what is the mechanism of action for botulism? Yeah, acetylcholine, what does it do? Yeah, it inhibits the acetylcholine release. Yes, you are right. Correct, Amini. It is a neat PG channel. Ro- Okay. We are just going through Q&A of some random neat PG questions. Okay. Can you tell me what is the for drug which inhibits the MTTP or drug which inhibits PCSK9, like anti-cholesterol drugs, PCSK9 inhibitors, and no, not BSc nursing. Yeah, it is difficult to remember actually, even because that is the question from INI mock in today's exam, replied at mock. Yeah, I have somehow marked it. I don't know whether it is right or not, but I'll just check it once because it is in my shorty copy, but I didn't revise my shorty copy this time. It's somewhere. Yeah, MTTP. Yes. Yeah, I'm 2017 batch. It is difficult, okay? That is why we are preparing this much. Uh, okay, for some time I'll just keep it in subscriber mode because people are popping up. I don't know what to answer also. So, okay. Yeah, in MTTP, you have to look for M and T and P in lomitapide. So you can see lomitapide has M, T and P. So it is related to MTTP gene, a drug related to MTTP. And PCSK9 inhibitor is inclisiran. Okay, inclisiran, that is asked multiple times. So maybe try and remember it this time. Okay. Now MTTP is little bit easier to remember now. And bempedoic acid is a citrate lyase inhibitor. This is what I remembered in the exam. So I think only one option is there with this option. I marked it. Just a second. 1 second. Bempedoic is also there for citrate lyase inhibition. Okay. Um, and also bile acid binding cells were also given. It is remember 2 to 3. MTP is a little bit easier to remember. 1 second. guys. Sorry for the disturbance. Eptifibatide, yeah, eptifibatide is no. It is something related to antiplatelet. No, it is not related to here. It is anti-cholesterol and it is anti-platelet eptifibatide. So yeah. And coming to Hinchi classification, can you tell me for which disease it is it Hinchi classification? Yeah, you're right. Diverticulitis, very good. I'll flip through the BTR now for some time. So, can you tell me grid iron is muscle splitting or muscle cutting incision? Yeah, splitting. Great. Yeah, Rutherford is muscle cutting. And what is Oshna-Sheran regimen for? And what is McAfee's regimen for? McAfee regimen and Oshna-Sheran regimen. Yeah, appendicular, yes, sorry, mass, lump, yes, you're right. And McAfee, yeah, great. Class Then, can you tell me what are the components which have score 2 in Alvarado score? So what are the score which gets 2 in Alvarado score, and what are the scores which gets 2 in Wells score? Yeah, leukocytosis and anything. Yeah, tenderness. Then in Wells score, what are the two giving score there? What is Wells score for? No, 2 will be there. For which components it is 2? I think it is unlikely other causes unlikely than PE. It is 2, I guess. And one more thing will be there with the 2. Please check and tell me. I don't think 3 is not there. It is 3. Oh, I'll check it. Wait. Okay, for more than 3 days of bed rest and travel as a 4 week surgery. I just can't find DVT right now. In Respi, right? Just a second. I'm going to Respi now. Yeah. No. 3 score is for signs and symptoms of DVT, and also, as I said, unlikely. Pulmonary embolism, unlikely other causes, that is 3. I hope I am understood well. So, other causes are unlikely than PE, that is 3 score, and also some signs and symptoms of DVT is 3. And other than that, hemoptysis is 1, cancer is 1, remaining all are 1.5. Okay, just now. Thank you so much, Nandini. So, is it okay now? Have you got some clarity? Signs and symptoms of DVT and other causes less likely than PE. Both are 3.0 score, okay? Then కాసేపు మాట్లాడుతున్నాను. So, okay. Can you tell me the drug of choice for interstitial pneumonitis, interstitial pneumonia? I'm so sorry, guys. My mom is like, she's disturbing me all the time, and I'm not able to do. Okay. Some examples for hypercapnic respiratory failure. No. Regular pneumonia, you can do that, but there is specific drug of choice for usual interstitial pneumonias. That is pirfenidone, which is anti-TGF beta. Okay. Opioid toxicity, I don't know. Ma'am has given it here as obstructive sleep apneas and also COPDs. Must check it out whether opioid toxicity is there and let me know. Okay, then it is not there. What is the major difference between obstructive sleep apnea and Pickwickian syndrome? Major difference between obstructive sleep apnea and Pickwickian syndrome. What is Pickwickian syndrome, first of all? Yeah, you're right, Minnie, correct. It is present in daytime also in Pickwickian syndrome. Okay, then just a second. Can you tell me V by Q ratio is 0 in which conditions? Ventilation by perfusion ratio is 0 in which conditions? I think it is less noisy now. Yeah, in physiological shunts, it is 0 and it is infinity in which conditions? Like collapse, pneumonias and pulmonary edema. COPD is not 0. It is just above than that. So yeah, you're right, Shelby. Okay. Just remember the examples of physiological shunting. V by Q is 0. Maximum airway resistance is seen in which generation of bronchi? Maximum airway resistance, yeah, third to fifth, Shelby, you're right. I will ask you the rejection and you have to tell me type of hypersensitivity. What is the rejection that graft will give the host, and what are the rejections that will be given by the host to the graft? What did I ask? Oh, you have to tell the number, Mini. Third to fifth is the number, okay? Yeah, which is 4, yeah. And can you tell me the rejection by which host gives to the graft, and also what are the number of hypersensitivity reactions for them? Yeah, it has different stages. Okay. Yeah, you're right. If it is acute also have two types again, humoral and cell mediated. So if it is humoral, then it is 2. It is cell mediated immunity, then it is 4. Okay. Yeah, type 2 is hyperacute and the HH ones are type 2. So hyperacute is type 2 and the this acute the humoral one is also type 2. The HH ones are type 2 and the cell mediated immunity and the chronic CC ones are type 4. I mean, if you have any confusion there, okay. Then this is a little out of question which I have annotated in my VTR, that is, what is the maintenance therapy for renal transplant? What drugs you will give in maintenance therapy of renal transplantation? Yeah, I have answered it, Mini, already. We are talking about cyst yesterday, not E. coli. It is Entamoeba coli, Entamoeba histolytica, and Entamoeba coli. We all know in histolytica we have tetranucleate cyst, so it is 4 nuclei in histolytica, and in Entamoeba coli it is 8. Okay. Transplant therapy for kidney, we have triple therapy for it. Okay, it's okay, Sushant, you can now join. I may continue it for 5 to 10 minutes more. Okay, you can join now. Yeah, it is there. Entamoeba coli is also there. It is not well known, but it is there. Okay. The triple therapy drugs include cyclosporine, azathioprine, and prednisolone. Remember that. Yeah. All those three drugs are used. Yeah, erythrophagocytosis is seen in Entamoeba histolytica, and you should also remember what is the treatment for rejection in transplant, renal transplant. What do you do for rejection in renal transplant? Like any. Right now, I'm doing microbiology too. Okay. Okay. In rejections, remember guys, prednisolone is given for 3 days. If still it is not subsiding, then we give anti-thymocyte globulins for 2 days. Okay. Am I audible now? I think it is audible now. Hyperacute, we cannot do anything, but if it is, other rejections, we can give prednisolone, and if it is not subsiding, then we should give anti-thymocyte globulins, which is sometimes asked, especially in ENISET. So if it benefits you, then most frequently asked, what is the GFR for grade 3? Try remember and tell me. Don't study transplant separately. Just go through the marrow Q bank and all. When you find that question anywhere, you can search the explanation and then you will get it. That is how I return it in my BTR. So that is the best way I feel, because anywhere else you have to go and refer and you don't even know that is important or not. That is what I suggest you. Yeah, 30 to 45 guys, play with 15 till 90. So start with grade 5. Less than 15 is grade 5, so 15 to 30 is grade 4. 30 to 45 is grade 3. That is how you go up. Okay, 30 to 45, not 30 to 60, Sushant. Okay. I feel like I forget everything from the previous subjects. That is why revision is very important, which we all, most of us, lack. So then, just a second. So, what is the approved drug for non-alcoholic steatohepatitis? Hi Achyut, I'm fine. How are you? Can you tell me what is the LKM which is given for autoimmune hepatitis? LKM number? Because LKMs are important. Anti-LKM 1 is seen in, and anti-LKM 2 and 3 are seen in. Yeah, vitamin E is right, Mini, you're right. No, it is LKM 1. LKM 1 is seen in autoimmune hepatitis. LKM 2 is for drug induced. Okay. LKM 3 is hepatitis D. Okay. Hepatitis C is 1, D is 3, and in between the 2 is drug induced. Autoimmune comes for LKM 1. Okay. Revise it, two more times. Yeah, 2 is drug induced. 1 is hepatitis C, 3 is hepatitis D, and Autoimmune hemolytic anemia is 1. Okay. Yeah. Then what does ETO cells do? ETO cells in liver, where are they present and what does they do? Very non-specific and not so important, but may be asked. It has some property. Yeah, it stores vitamin A. Can you tell me where else we see this ETO name in dermatology? Yeah, vitamin A storage. You are right. You're right, guys. In space of Dissay, right method. Great, Achu. Can you also tell me where else we have seen the ETO? Is it epidermal problem or the dermis problem? Yeah, yeah. Is seen ETO is in like shoulder. Yeah. Okay, then I'll tell you the toxin. You have to tell me which zone of liver is affected. Yeah, you're right, dermis. So, having said that, dermis will be brown in color or blue in color. If dermis is affected, which color do you get? Cocaine affects which zone? Hypoxia affect which zone? Yeah, blue. You're right. I'm audible now. Yeah, hypoxia is 3 because of less blood supply. Uh, One is cocaine and viral are first zone, not central. It is first zone. Okay. Zone 1 is viral and cocaine. Zone 2 is yellow fever, guys. In zone 2 we have only one thing, that is infection, that is yellow fever. Oh, it's okay. Learn it, Sushant. I don't have any, but only one thing you have to remember: 1 and 3 are important. 2 is only for infection, yellow fever. Zone 1 is for viral and cocaine, and 3 is for hypoxia because least blood supply. So hypoxia is prone to zone 3. That is how you may remember it. BTR, I am following only BTR, nothing else for now. So yeah, just remember at least hypoxia is for 3, and zone 2 have only one infection to remember. Okay. And even metabolized toxins also come under 3 because of least blood supply, same explanation. And because of the same explanation, most blood is there in zone 1, so virus will come, and more virus will come, I think, maybe affecting it. It's okay, Akshita Sharma. It differs from people to people. Even I am not perfect in making choti copy. I am trying to improve it day by day because sometimes I forget everything. I want to write everything in choti copy, and then it is no use. You can't revise it, and also you have to remember it in brain, not in book. Only numbers and also grading the named ones or the things which you are frequently doing mistakes. That is what you should write. What I feel. And can you tell me what is the drug of choice for hepatorenal syndrome? Yeah, visual memory is so important. It's so fine that if you are not able to keep your choti copy concise, at least try to improve it along the way for neat. And I think Anisette, I have stopped writing choti copy since then. I am trying to keeping it in my brain until that if I am making it multiple times. 2.0 only. I am not doing 1.0 now because ma'am have said it now, so I don't want to do 1.0. Okay. And hepatorenal syndrome, can you tell me the drug of choice? I think we will stop, or do you want? Yeah, it is terlipressin, guys. You can use albumin and also terlipressin. octreotide. These are all drug of choice for hepatorenal syndrome. It's okay. Yeah. Yeah. No. Remember that we have to give albumin. For hepatorenal syndrome, we have to give albumin, and also, yeah, terlipressin and octreotide is something you have to prefer. Okay. Okay, then we'll stop at 6 o'clock. Okay. Uh, Xylitol is leukotriene. Leukotriene, it says something about it. Okay, then. Can you tell me which lesions resolve with management in IBD? Okay. Listify inhibitor. Okay. You can volunteer, guys, for questions. It's not one way. You can be two way. Three conditions. Yeah. No. Pyocanism will not resolve. So that is the first thing you have to eliminate. Pyocanism will not resolve. Erythema nodosum is right. Yeah. Episcleritis and arthritis. You are right. Arthritis, episcleritis, and erythema nodosum resolve with management. వాళ్ళకు పెడతావు కొంచెం ఎందుకలా చేస్తున్నాను. No, pyoderma gangrenosum is not treated with this one in IBD. What are the tumors in Tarcott syndrome? Just mommy things. Does what is not to be done. Okay, then can you tell me two things? Yeah, medulloblastoma and what else? Yeah, Tarcott syndrome. And when to do annual examination for FAP and for MUTYH? No, it is 10 to 12 years in FAP, 20 to 25 years in MUTYH. Okay. At age 10 to 12 in FAP, at age 20 to 25 in MUTYH. Can you tell me the repair that is seen in MUTYH? Repairs? Yeah, great. It is basic scission repair. And having said that, xeroderma pigmentosum. Yes. Then STK11 mutation. No, no. Yeah. STK11 mutation. SMAD4. Can you tell me what are the things present in Cowden syndrome? Cowden syndrome. Yeah, you're right, guys. SMAD4 is juvenile and STK11 is Peutz-Jeghers. Great. And Cowden syndrome. Cowden syndrome is. Can you tell me what we'll see in that? Which mutation? What cancers? P10, right? What mutations? Yeah. Yes. Bed cancers and yeah. And one more thing. Tricholemomas are also seen. Don't forget it. Tricholemomas. And okay. Can you tell me what are the neoplastic ones in colon cancers? What are the neoplastic histological types in colon cancer? Is it hematomatous, tubous, hyperplastic, villus? Which one? Yeah, villus and tubular. Great. Tubulus and villus are metastatic. Nice. And coming to this. Okay. Schistosomiasis comes under which type of portal hypertension? Is it hepatic, prehepatic, or posthepatic? Be quick, guys. You are fast. You will get more questions. Yeah, great. Very important question. Prehepatic. And what cancer does cystosoma cause? First, what cancer does cystosoma cause? Which cancer and which type of cancer? Yeah, SCC of bladder, and it can also cause transitional, but squamous is most common. Can you tell me terminal spine is seen in which type of cystosoma? You are right, Akshita. You are right. Yeah, terminal spine. Even hematomium, yes. In Japonicum, it is. Can you tell me the sheathed microfilaria larva? Sheathed microfilaria larva. You got monoclonal antibodies. I have written some of them, but I didn't include everything. Maybe just remind me. I will just assemble all of the antibodies before the exam of the INISET. Okay. Yeah, LBW, yes, Wuchereria, Lova, and Brugia Mali. Okay. And can you tell me how can we differentiate between them? Fast. Wuchereria will have how many nuclei at the end? Lova will have how many nuclei at the end? And Brugia Mali have how many nuclei at the end? Yeah, Japonicum has rudimentary sign, right, Sudhanshu? Yeah, Wuchereria have no nuclei. Lova has, yeah, 2 nuclei. No, Lova has nuclei in a line. Brugia has 2 by Brugia by and 2. Okay. Then okay. I will tell you 2 to 3 things. You have to tell me the diagnosis. Okay. If the vessels are dilated above the umbilicus and the flow is away from the umbilicus, what is the diagnosis? I mean, what is the condition? If same condition, the vessels are dilated above the umbilicus, but the flow is below from the umbilicus, then what is the syndrome? And if the lesions is below umbilicus and if flow is towards umbilicus, then what is it? Yeah. um, have a clarity here, guys. Yeah, Akshita Sharma, you're right. The first one is caput medusa. If they have mentioned above umbilicus, we have two things. One is caput medusa and one is SVC syndrome. Okay, and if it is below umbilicus, we have IVC syndrome. Above umbilicus, if the flow is towards the umbilicus, then it is caput medusa. Sorry, if the flow is away from the umbilicus, it is caput medusa. If the flow is towards the umbilicus, it is SVC syndrome. No, last one is not caput. The first one is caput mini. It is not given. It is annotated stuff, guys. I have said now. Um, yeah, I will repeat it. Just remember one thing. See whether the veins are above the umbilicus or below the umbilicus. If it is above the umbilicus, we have two things to remember. One is caput medusa and other one is SVC syndrome. If it is below the umbilicus, we have only one thing, of course, inferior vena cava, so IVC syndrome. Above the umbilicus, you have two things now. How to differentiate between them two is you have to see for the flow. If the flow is away from the umbilicus, then it is caput. If the flow is towards the umbilicus, then it is SVC syndrome. No, it looks confusing. That is why I just remembered it. Please don't ask reasons for some things. I don't know. Yeah, both are. Just remember it. It saves your time and your they will not go deeper than that. Yeah, I hope it will be helpful. I mean that is how I want you to annotate BTR too, because not everything, some questions are regularly repeated and you will do mistakes just like me. I have done mistake in this question, so yeah, it's okay. Now you have to remember, okay? No, guys, it's been 6 o'clock. I have to study now. I am lagging in many subjects. Okay, then 5 questions. Last 5 questions. Okay, no more questions. Uh, okay then. Yeah, because the time is limited now. I am doing job, so I have to complete. Yeah, it is included. First you see whether it is above or below. Then if you have got it to above, then see the flow. If it is towards or it is away it is caput, towards it is SVC. That's it. Okay, three questions. Okay, then can you tell me? Uh, so sorry for the disturbance. Can you tell me how much amount of fluid should you have to elicit fluid thrill? Very important and very frequently gone wrong. Guys, in GT10 I've got 121 correct, and in the AIMS mock of prepladder I've got Varas score 114 correct. Okay, happy. Okay, then yeah, 1500 guys, great. I usually get confused here. And what is the delayed drug of choice for delayed vomiting in cancer induced vomitings? Good going, but it is not enough. I have to do more and more. I'll try my level best till the exam. We'll see how it goes. 5 to 8 o'clock. Yeah, Apributan, great guys. Can you tell me chlorine channel activators for constipation, which are very confusing? Chlorine channel activators. Great, Akshita, you're doing very nice. 140 is like, I mean, in exam you will get an unimaginable score, don't worry. Yeah, it's okay, re-revise. I'm not minding anything. I will study now. Okay. Yep. No. I'm talking about constipation. It is not loperamide, Rakesh. It is lubiprostone. Great, inside DPG. Okay, guys. I hope I this live session is useful to you in any way possible. No, Nasir. It's okay. We have to grow together. That is the main motto. Okay, guys. Yeah. Please go and study. I hope it motivated you. Don't think any negative thoughts now if you are not able to answer, because it's completely fine. Usually I do it for 5 to 8, but today is Sunday. Please give me some scope of leaving early, and I will study better without live, with all the comfortable seating position. So this is not at all good. Thank you so much, Akshita. Hope may I end up with good result too, along with you guys. Uh, okay. Thank you so much. Thank you, Minnie. Thank you, Shelby. Bye bye, guys. No more wasting of time. Go back to your study tables. Um, yeah, I hope it should come in the exam. Otherwise, it is, at least it should help you in any way possible in ruling out options. I love pharma somehow, but I haven't yet started that subject. Um, okay, bye, please. Yeah, just now I said I have 5 to 8 only. I will do it tomorrow. Today is Sunday now. I just want to some time gap for now, because I have asked so many questions, and my mom is like, she's pushing me all the snacks, all the tea from the table, from here and there. I can't control her. So yeah, I felt it difficult. I don't know about other people. Yeah, I'll try to do, but you should not extend it more than 15 minutes, because it I should also study, right? I'm aspirant just like you. So yeah. Yep, mom's love is never ending. She's like, she's voluntarily doing things that I don't like. Okay, then no more talking. Just bye. See you tomorrow. Just keep studying, and no more demotivation about whatever. If you cannot answer any of these questions, it's completely fine, because I may not know whatever you know. So just don't bother about it and keep studying. Bye.